Of My Carolina is sponsored by.
We are here at Tryon Family Dentistry in the consultation room. I'm with Dr. Caroline Hamilton. Dr. Hamilton, thank you so much for having us today.
Thanks for being here.
Well, we're going to talk about something that I am so intrigued with because it's something I personally deal with, and I know you say it helps your patients so much. It's Botox.
Yes.
And we're not talking Botox for cosmetic reasons. This is not for those fine lines and wrinkles. This is actually for your health and for your teeth.
That's right. We're in a really unique position as dentists that we're able to treat oral facial pain and headaches for our patients using Botox.
So something like that, I know for me, I clench and I break my teeth, and I do it while I'm sleeping, I do it while I'm just sitting there, and it does result in headaches. Is this a common occurrence for people?
It is a really common occurrence. We've seen it a lot in dentistry, and especially over the last couple of years with the pandemic and all the stress that people have been under. I think it's been on the increase.
So how does something like Botox, which most people think of that they want, and they want to look beautiful and do all of these things that for those, I don't want to say artificial reasons, but on the surface, this is actually going in and helping your jaw.
Right. So there are a lot of different causes of oral facial pain, some of which are muscular in nature. So Botox is one of a class of neuromodulators that we can use to target specific muscle groups, which can be the cause of pain for people who are overusing them. So if you're clenching at night, grinding at night, those muscles of mastication, the chewing muscles, get overused. They grow in size, and then they can cause pain from that overuse. So by targeting them with Botox, we're able to temporarily reduce their ability to contract, and that can lead to pain relief, which is really amazing to see in patients.
Oh, I can only imagine. It's not just pain relief. It can be expensive when you're breaking those teeth and having to get dental work done constantly.
Exactly. So it's something we're always kind of looking and checking for in our patients. People that complain of soreness, difficulty opening their mouth or staying open, even during a routine cleaning, clicking and popping of the jaw, and certainly people that have a history of, breaking teeth or broken restorations. Botox can help with all of those things.
And it's so important to have a doctor like yourself be able to do this process and be able to pinpoint where the actual issue lies so that you can correct it.
Exactly. Not everyone is a candidate for this treatment, but we do a thorough examination to try and determine the cause of the pain or discomfort and make sure that administering Botox is going to be a good treatment modality for you.
Okay, so Dr. Hamilton, it's really good to know that we have an expert like you to go in and check in. It's not get a couple shots, come back in 4 months and see if it did any help or if it worked. You're actually guiding this entire process all the way through.
Right, absolutely. So we as dentists are used to seeing our patients regularly. I do like to check in on progress, and there are some other therapies that we'll sometimes add in as an adjunct along with Botox for treatment of facial pain and headaches.
Which is also good to know that it's not just that miracle shot, that if that's not working, then you have ways to help it along as well.
Right. Oftentimes these issues are multifactorial, so there are also multiple ways that we can address them.
Well, how do we make that consultation or get a hold of you?
You can just call Tryon Family Dentistry, and one of the front desk ladies will set you up an appointment with me.
Awesome. Well, thank you so much, Dr. Hamilton. We appreciate it.
Thank you.
The proceeding was sponsored by. Stop searching